Good morning, everyone. Sincere apologies for running a little bit late. Good morning, and dear ladies and gentlemen, esteemed colleagues, distinguished speakers as well. It is my great honor and pleasure to welcome you here in my capacity of coordinator of the European Patient Group on AMR and also a member of Health First Europe team to this important event on engaging with patients and closing gaps to fight antimicrobial resistance. The European Patient Group on Antimicrobial Resistance was officially launched in November 2020 to coincide with the World Antibiotic Awareness Day and the European Antibiotic Awareness Day 2020. And the AMR Patient Group is an initiative by Health First Europe and is made up of 27 national patient associations coming from all over Europe. We brought together these patient groups, patient advocates, with the idea to address the gap in awareness at the patient level about the danger of antibiotic misuse and the lack also of effective infection prevention and control measures. So we have run several workshops. We have been engaging with these patient advocates to empower them, to educate them, to raise awareness about AMR, and also empower them with the right tools and solutions so that everybody understands when it's appropriate to take antibiotics and also how to take them more responsibly. This event is jointly organized by the European Patient Group on AMR and also the MEP Ambassador Group on AMR, which is an initiative of Health First Europe. I personally and particularly thank MEP Knotek for hosting us within the premises of the European Parliament. I believe that this event is of great importance to all stakeholders involved in public health, in infection prevention as well, but also in other sectors such as the environment and also the agricultural fields. So thank you so much for being with us today and to all the people who are also joining us remotely. I would like to encourage everybody to actively engage in our discussions, share also your country experience, and also ask questions, not only to our expert speakers, but also to one another, really to make this event as truly interactive and lively as possible. We're also active on social media. Feel free to use the hashtag AMR Patient Group to liking and sharing our content. Today, we will hear from several high-profile speakers from the European institutions, from the ECDC, patient advocates, from the doctors associations, and also the medical technology industry. Today's event is a great opportunity to facilitate the exchange of best practices in Europe and also discuss how we can intensify our actions to save lives, but also to protect and enhance patient safety across Europe. So at the end of this meeting, we aim at having a clear picture on the current challenges, existing trends, but also about the solutions that can be in place and can be implemented to combat AMR. Before we start, let me give you some brief housekeeping rules. I know that all experts, after more than 2 years of the world of virtual meetings, so this is a short reminder. This meeting is being recorded. So that it will be easier for us to capture everyone's contributions in a short report afterwards. We will also be sharing some questions through the Slido platform to make the debate more dynamic, more interactive. And this is a particular request for the online audience. I kindly ask you to please stay on mute while our speakers are presenting. Of course, you can use the chat window to submit any question you may have, any viewpoint, any reaction as well during the debate. Without further ado, I now hand the floor to Dr. Roberto Bertolini, advisor for public health at the Ministry of Health of Qatar. He's clinical professor in public health at Qatar University, adjunct full professor at Hamad bin Khalifa University, and visiting lecturer at the Global Health Master Program of the University of Milan. He is also a member of the Scientific Committee on Health, Environmental and Emerging Risks of the European Commission, and honorary president of Health First Europe. So the floor is yours, Roberto. Thanks.
Laura, can you hear me?
Yes, we can.
Okay. All right. Good morning to everybody, colleagues. I'm very pleased to be somehow indirectly back to the European Parliament. When I have been director of the office of WHO in Brussels, I was there a lot of times, so it reminds me of this experience. I think the meeting of today is extremely important and very interesting for the future of public health and the future of the European the health of Europeans and also globally. I think AMR, antimicrobial resistance, is one of the, I would say, 3 issues on which the scientific community has raised significant concern over the last few years, and I would say even decades. One is the risk for a pandemic, and we've seen what happens if you don't listen to the science and to the recommendation coming from the scientific community. The second one is climate change and health, which continues to be, and climate change in general, which continues to be an issue of high relevance, but on which I would say the scientific concerns and let's say, and the actions to be undertaken to prevent these consequences does not seem to me particularly at the top of the attention of the policy and the scientific, the policy community at this point in time, also because of the changes which have occurred in several countries in Europe during the last couple of years. And finally, the antimicrobial resistance, on which the scientific community has raised concern from the last years of the last century. And then, you know, in the last 20 years, there have been a lot of statements, plans, actions, which has been undertaken. So it seems that in this area, the response of the policy community has been a little bit more attentive than in other areas. However, I mean, we need to stress once again that this is one of the major concerns and the major issues that the public health community has to face in the next decades. And without properly addressing these issues, we might risk to be in a situation in which, as you all know, so I don't need to convince you, but I'm simply to underline the importance that we might be in the situation in which common diseases that we have even forgotten somehow, because we know that there are effective antibiotics treating them, and therefore, I mean, creating a situation which is good for the health of the population, might not be treatable anymore, or may be treatable with a very severe health side effects with some of those diseases, the drugs which might produce. Now, as you know, I mean, the antimicrobial resistance is causing, in addition to a very significant human suffering, and I know that we will hear from a patient which had gone through a very serious experience in the last years, I mean, in the second part of the conference today, but we also have a significant cost. The World Bank has estimated that in 2030, there will be a fall in GDP due to antimicrobial resistance and the consequences in the population, which will, they estimated to be in the order of $3.4 trillion US dollars. This is, of course, these are estimates, but just give you an idea of what could be the impact on that. And also the same in another report, I mean, addressing the situation in 2050, they mentioned 10 million deaths, I mean, as possible consequences of antimicrobial resistance, which mean a number of deaths more than all cancers together. Now, I mean, without going into too many details, and I'm very curious to listen to the presentation later on, I just would like to invite all of us to think, in addition to what are the plans that are going to be implemented and the actions which are going to be taken, to reflect a little bit on what has been the experience so far. So which strategies has actually worked and which strategies have not worked so much. And in the latter case, what are the reasons why they didn't work? So, I mean, I think we have to intensify the action, but being a little bit attentive to what is the experience we have gained so far in the last decades of many actions in this respect. So, okay, I think we have a number of speakers that are now going to address the audience here. But first of all, I would like to invite Mr. Ondřej Knotek of the Renew Europe of the Czech Republic to address you. I think there is a video that has been prepared. Mr. Knotek is a member of the ENVI committee and the Special Committee on Beating Cancer. He's also co-chair of the Transform MEP Interest Group, which aim at informing, educating, and promoting dialogue on transformative therapies. And he's also a member of the informal MEP Ambassadors Group for Antimicrobial Resistance. In his previous life, he was a quality manager in the pharmaceutical sector, so he knows, also technically, the field that we are talking about today. So Mr. Knotek will address the audience through a video. So Laura, I think you can go ahead with that. Thank you.
Dear guests, I would like to thank you all for participating today to this roundtable on the fight against antimicrobial resistance. I would like to thank the European Patient Group on Antimicrobial Resistance and Health First Europe for organizing today this timely debate. When the COVID-19 pandemic started in 2020, we all suddenly realized the impact that public health problems can have in everyone's daily life. The pandemic affected all of us, no matter our social status or personal situation. While COVID-19 has receded as a major issue of public debate nowadays, and another silent pandemic is unfortunately developing throughout the world, and this is the antimicrobial resistance. As you all know, the inappropriate use of antibiotics can have dire consequences for every citizen, independent of their health status. When bacteria become resistant to the most widely used antibiotics, regular medical interventions can become unnecessarily risky, and infections become increasingly difficult to treat. Ultimately, the development of superbugs is a threat to advances of modern medicine and can set us back by decades if not addressed properly. Unfortunately, in many countries, there is a general lack of awareness among patients about when and how it is appropriate to take antibiotics. Many people believe they can be used to treat viral infections, such as cold or flu, when this is not the case. Additionally, often overprescription is also a problem, with some healthcare professionals prescribing antimicrobials without being certain of the nature of a given infection. With 25,000 deaths per year only in the EU, the AMR represents a clear cross-border public threat that could cause more deaths than cancer by 2050. AMR must therefore be addressed at every level. European and global institutions need to continue monitoring the development of resistance and issue recommendations on how to address it. The EU's One Health Action Plan against MMR is a good step in this direction, calling for more research and development to close the knowledge gap and provide new tools to prevent and treat infectious diseases. But actions are also needed at national, regional, as well as local level to address the knowledge gap among patients and among some healthcare professionals. The role of national and local patient representatives, such as the members of the European Patient Group on Antimicrobial Resistance, is therefore essential. They should get all the support they need in informing citizens about the danger of AMR through campaigns in healthcare and non-healthcare settings. I would like to thank once again to European Patient Group on AMR for organizing this debate and wish you to have a lively and fruitful discussion. Thank you once again to all panelists and participants for participating to this debate. Have a good day.
Thank you to Dr. Knotek for this brief address. I think this is he summarized in a very short way the most important issues. And I'm very, very pleased now to Andrea Amon. Andrea Amon is, you know, I had the pleasure to meet her in the past. I mean, and I think I'm playing a role as director of ECDC in a very effective way. She has been there from April 2011 she has been in the ECDC from 2005, as a matter of fact, with different responsibilities. And now she has been director of the ECDC since June 2017. And Andrea has been extremely effective and very professional in her work. I mean, she has developed the European surveillance system, which has been very instrumental in monitoring the infectious disease in the European Union. And she's also been responsible for producing the annual epidemiological report on infectious disease in the EU, then also which has been one very important instrument to understand the situation and to monitor what was going on. And before joining ECDC, Dr. Amon has been at the Robert Koch Institute in Berlin, where he's also developed the German national surveillance system, plus a number of other activities. And in that role, she has played an important function of providing scientific advice to ministries, members of parliament, the public. Basically, I mean, what she has done in Germany, she has now been doing for several years at the European level. So, Andrea, thank you very much for being with us, and I'm looking forward to listen to you.
Thank you very much, Roberto, for this nice introduction, and thank you to Health First Europe for inviting me here, because I think it's a very important topic. Antimicrobial resistance constitutes one of the most significant public health threats that we have in Europe today. And I think the significance is highlighted by the fact that in the past 2.5 years, although we devoted most of our work to COVID, we never stopped working on antimicrobial resistance. So next month, in connection with the annual European Antibiotic Awareness Day, we will publish the new data from 2021 on antimicrobial consumption and antimicrobial resistance, as well as updated estimates of the health burden of AMR in the EU. So although I cannot present the new data, what I want to speak about is the trends that we are seeing. In 2020, both antimicrobial consumption and AMR decreased. And we think it's most likely an indirect effect of the prevention measures that were taken for as control measures for COVID. And maybe also changes in the healthcare seeking behavior that were associated with this. Despite of this, we still see high levels of AMR for several important bacterial species antimicrobial group combinations, which confirm what has been already said, that AMR is indeed a slow and silent pandemic with a major impact on the health of Europeans. So important message that is worth reiterating is that the burden of AMR in the EU remains similar to the burden of influenza, tuberculosis, and HIV combined. So the most frequent or highest burden diseases, and AMR is -3. So and for some of the resistant pathogens, the incidence and the burden has decreased, but for others it has increased. And our estimates also indicate that 70% of this burden is related and linked to healthcare-associated infections. So the link between AMR and the hospital infections is really very, very close. And we will do in next year finalizing actually our new round of point prevalence surveys in hospitals, where we look at the healthcare-associated infections, the consumption, and the AMR at the same time to see also the links. And we see then compared to the surveys 3 or 4 years ago, what has changed for the better, hopefully, or for the worse. So in addition, what we're seeing, there are new threats for AMR emerging and spreading, and such as Acinetobacter baumannii and Candida auris, which is a fungal pathogen that is resistant to most antifungal medicines. And both pathogens are responsible for healthcare-associated infections and outbreaks. And in connection with the upcoming regulation on serious cross-border health threats that now was also adopted by the Council this Monday, we propose that Candida auris is actually added to the list of pathogens that is covered by the epidemiological surveillance network, because it has become now really very frequent. So what I would like to summarize now is what we are doing in support of the European One Health Action Plan against AMR, which is a set of actions that we very much welcome. And we are happy and heavily also contribute to the development. The support that we have provided to national AMR reference laboratories and building capacity for whole genome sequencing in these national laboratories to integrate the whole genome sequencing as part of the AMR surveillance activities is showing results. So, and we would like to thank the member states that are now actively also using the a new platform that we have, where they can exchange on these threats that they find with the sequencing, the EpiPulse platform. So these efforts have allowed to identify cross-border spread of multi-drug resistant bacteria and informed ECDC's rapid risk assessments. And in the past 3 years, those risk assessments that were not relating to COVID, most of those were related to these multi-drug resistant pathogens that were causing outbreaks in hospitals. We have also started together with DG Santé our program of joint One Health country visits on AMR in a joint view with veterinary and public health. So a visit to Cyprus took place last week, actually, and for next year already 4 member states have indicated their interest. And from our experience, and also what we get as feedback from the visited member states, is that these visits that look in parallel on the veterinary and public health sector are really unparalleled opportunities for countries to identify improvement areas and feasible actions that they are jointly done. So I was very pleased recently hearing a country really reporting on their national action plan, which I know was based on such a country visit. So I think that is a very effective tool helping and supporting the countries to identify and get into action mode. It's important that we recognize that AMR in humans is driven not only by the use of antimicrobials in public health, but also, of course, that the reservoir in animals may play an important role. So to that end, we collaborate with EFSA and EMA on an integrated analysis of the consumption and resistance of data from humans, food producing animals, and we produce these reports in 3-year periods called Chayakra. That is basically a One Health report for 500 million people I don't know how many animals it comprises, certainly at least as many, which is unparalleled in the world. So there is no such big area where such a joint analysis exists. And next year we do the next one. The ECDC is also partner on the Transatlantic Task Force on AMR, which brings together technical experts from public health, from the US, the EU, Canada, Norway, and the UK. And in 23, we will also develop our own One Health framework that tries to take stock what we do in the One Health area, mostly, of course, on AMR in hospitals, but also on food and zoonosis. So summarizing, together we have made really good progress in the past 15 years, and but we see new AMR threats arising globally and in the EU, and that means that we have to keep on applying the principles that we are saying since years. We have to use antibiotics prudently. We have to use and apply infection control practices. And I would like to invite you to mark with us the 15th European Antibiotic Awareness Day. You see the full program on our website, antibiotic.ecdc.europa.eu. And the theme that we are following this year is preventing antimicrobial resistance together, which is a reminder and an acknowledgement that keeping antibiotics working is the responsibility of everyone. Thank you.
Thank you, Andrea. Thank you very much. This has been a very, very clear summary of the many actions which have been undertaken by WHO, by ECDC and the European Union.
And WHO. We're doing the report even now together.
Yes, you know, my old affiliation comes up sometimes. I just also want to take the opportunity to thank you very much for the great work which ECDC has done during the pandemic. I mean, I can tell you that the reports and the data produced regularly by ECDC has been used widely by well outside the European Union. So just to underline the quality of the work that is carried out by your institution. Now, I mean, you mentioned the new activities and the new plans being developed by the European Union. So we have the pleasure to have here virtually, I understand, two colleagues from the DG Santé, Céline Ledoux and Julia Langer, which will talk about the European response and the actions and the update on AMR and infection prevention. I think Céline will start first, and she has been in the European Commission since 2021, and she's coordinator of the EU policy and activities addressing antimicrobial resistance with the One Health approach. And before joining the Commission, Céline has been a public health researcher in Maastricht, and she has a master in international relations and European public health. And Julia Langer is also policy officer on health security of the European Commission. And she has been there since 2016 and focusing on antimicrobial resistance and also on the human health perspective for cross-border health threats. She has been drawing, she is participating in the preparation of several important documents, such as the European One Health AMR Action Plan 2017, and also other statements which have been taken by high-level fora, like, as the G7, the G20, and also bilaterally with several South American countries. Before joining the European Commission, Julia was in OECD, and she holds a PhD in cancer research from Imperial College, and also she started her career in actually the health system in hospitals. So I give the floor to Céline for the first part of this presentation, and then for the second part, Julia will follow. Please be aware of the time, because I've been told by Laura that we have to leave the room strictly by 11:30. Thank you.
Yes, thank you. Good morning. Can you all hear me?
Yeah.
Yeah. Okay, great. Yes, so I will start now. So yes, good morning, everyone. First, thank you for this opportunity to present the various elements of the EU response to AMR. My colleague Julia Langer and myself will introduce you to those, starting with the EU Action Plan, the new policy initiative, and the various elements of the EU Health Union, and also finally the international policy development in which the EU is involved. Next slide, please. So addressing antimicrobial resistance through a One Health approach is a priority for the Commission, as shown by the mission letter from President von der Leyen to Stella Kyriakides, which is the Commissioner for Health and Food Safety, who specifically mentions the importance of focusing on the full implementation of the EU action plans against AMR, but also to have a strong global presence to advocate for the prudent use and the access to antimicrobials. Next slide, please. The EU has been quick in recognizing the importance of tackling AMR with the first 2001 community strategy against AMR. This policy was later reinforced with the 2011-2016 Commission action plans, which was meant to foster really action among member states and which was notable for its One Health approach. I'll get back to what One Health means in the next slides, but then in June 17, the Commission adopted the One Health Action Plan against AMR, as requested by EU member states in the Council conclusion of June 2016. As you can see, since the adoptions of the action plan, other important policy actions have taken place in order to further strengthen EU's response to AMR. My colleague Julia will introduce you to some of those. Next slide, please. So before, I wanted to give you a very short introduction to what One Health mean. So One Health is a principle recognizing that human health, animal health, plant health, and the environment are all interconnected as microorganisms, including resistant bacteria, so such as resistant bacteria, circulate between the four, and therefore they must be tackled in all domains in a very coherent manner. So efforts by just one sector cannot prevent or eliminate the problem. And no more than a concept, it's One Health is also now an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors, they work all together to really achieve better public health outcomes. Next slide, please. So that's really the approach of the EU towards AMR with the EU One Health Action Plan against AMR. It involves 9 Commission DGs, with obviously the Directorate General for Health and Food Safety, but also DG Environment, DG Agri, DG for International Partnership, DG Research and Innovation, and others. It includes 75 actions and counting across the different One Health sectors, as mentioned, in order to truly have a coordinated approach to AMR. Having all the actions under one single coordinated plan means much more coherence and also synergies between the policies. Many of the actions support member states in their efforts to tackle AMR, and the action plan also includes a very strong global dimension because, as you know, AMR does not stop at national borders. Next slide, please. A bit more details now. So the overarching goal of the plan is really to preserve the possibility of effective treatment of infections in both humans but also animals. It provides really a framework for continued and extensive action to reduce not only the emergence but also spreads of AMR, and also it increased the development and availability of new antimicrobials, both inside and outside the EU. The key objectives of the plan, they are built on 3 main pillars, which are the first one, making the EU a best practice region. This requires better evidence, better coordination and surveillance, and better control measures. EU action also focus on key areas that help member states in establishing, implementing, and monitoring their own national One Health action plan against AMR. Then we have the second pillar, which is boosting research, development, and innovation. It does so by trying to close current knowledge gaps and providing new solutions and tools to prevent and treat infectious disease, and also improving diagnosis. And we have the third pillar, which is intensifying the EU efforts worldwide to really shape the global agenda on AMR. Next slide, please. Now, quickly, a couple of deliverables in each of the pillars. So under Pillar 1, to make the EU a best practice region, we have, for example, the AMR One Health Network, which is a network chaired by the European Commission. It includes government experts from the human health, animal health, and environmental sector, the EU scientific agencies, and recently it has started to involve different stakeholders. Network meets once a year and really provide for the members a platform to present strategies and to keep each other up to date with their progress, to share best practices, and to discuss policy options. We also have the European Antibiotic Awareness Day, which takes place on 18 November and is led by the European Center for Disease Prevention and Control. The aim is really to raise awareness about the threat to public health of AMR and the importance of prudent antibiotic use. We then have, for example, the Better Training for Safer Food Activities, which is a Commission training initiative for relevant professionals in member states to really improve the knowledge and implementation of EU rules and also best practices covering different relevant areas related to AMR. We have the EU guidelines for the prudent use of antimicrobials in human health. They aim to reduce the inappropriate use and to promote the prudent use of antimicrobials in humans. They target all actors who are responsible for or play a role in antimicrobial use in humans. Next slide, please. Now for the research pillar, I will not go into the deliverables details because there are truly a great number of research projects which are handled by different DGs depending on their area of work. But I will give you a couple of figures and present the work of DG Research and Innovation linked to the action plan. So under the previous program, Horizon 2020, the EU has invested 600 million on AMR alone to support research and innovation for the detection, prevention, and treatment of infection caused by resistant pathogens. The Commission also supported member states for the coordination of national research activities via the Joint Programming Initiative on AMR. That's a partnership that brings together the European Commission and European countries as well as third countries. Now, under the current Horizon Europe program, the Commission is continuing to support AMR research and development, facilitating collaborations and strengthening the impact of research and innovation in developing, supporting, and implementing EU policies. During this first year of implementation, already 119 million have been committed on 48 research projects. In addition, the Commission is also engaged in the development of Horizon Europe European Partnership on One Health AMR and is ready to co-fund it up to 100 million euros. Next slide, please. Last, we have the EU implication at global level, which my colleague Julia will elaborate on with the most recent development in the area. But as a matter of example, the EU has been continuously contributing to the work of the major international organization to really reach ambitious international standards, guidelines, etc., related to AMR. The EU is also strongly involved in TATFOR, which is the Transatlantic Task Force on AMR, which brings technical experts from Canada, Norway, the UK, the US, and the EU to really collaborate and share best practices to strengthen not only domestic, but also global efforts to tackle AMR. Finally, the Commission also provides assistance in the development of AMR strategies in the area of food safety and animal health through regional training on AMR, such as the BTSF activities mentioned earlier, but for third countries. And the Commission also supports partner countries' initiative on AMR via different technical cooperation instruments. Next slide, please. Now I move on to the 23 policy initiative on AMR. It will take the form of a council recommendation. The aim of this initiative is really to extend and complement the action plan in all three dimensions of the One Health spectrum, but mainly on human health. And to do so, it will really provide recommendations to the Commission, but also to member states in their respective areas of competencies to really reach a coherent and effective response against AMR across the EU. But it will also include a global dimension, and the initiative will really take into account the new technological and societal development related to AMR. Next slide, please. So the initiative is really going through a very extensive process of collection of inputs from many different sectors, and it will be informed by, for example, the public feedback received to the call for evidence of the initiative that was published at the end of February and was open for a month, which gathered more than 200 responses. Also, the recommendation of the AMR One Health Network subgroup, which was tasked to provide really a set of recommendations and tools and priority action around AMR. The opinions of the expert panel on effective ways of investing in health, which is an independent panel with members from many different areas of expertise who studied the AMR question. And then we have the review of the AMR national action plans of member states, also the results of many different ongoing external studies, and finally the results of the 22 Eurobarometer on AMR. And now I will leave the floor to my colleague Julia, who will present the European Health Union.
Okay, can you hear me okay? Let me know if there's any issues. So yes, my name's Julia Langer. I'm a policy officer in DG Sante, and I really want to thank the host for bringing us together. I see many different stakeholders participating, so thank you for bringing us all together to discuss AMR. Okay, so I want to actually jump a bit into the European Health Union. Mainly because to highlight, in the last few years now already, on the human health side, we've really been focused on the COVID-19 response. And I think across several organizations and definitely with the member states, a lot of resources have kind of been deferred from AMR to the COVID-19 response. And the time is really high now to return our focus on AMR, which is still there, which has not been solved. And as Andrea Ammon kind of highlighted earlier, the epidemiological aspects are still very clear and it's still very much prevalent. So I think the time's really ripe for us to refocus on AMR. So thank you for the hosts to also bring our attention to this. Yeah, I'm sorry for not being there in person. I'm connecting from Luxembourg, so I send my greetings from there. So I want to highlight some of the opportunities from the European Health Union. Even though this is mainly the response to the COVID-19 pandemic, there are several opportunities for AMR, and you will see of the many kind of building blocks of the European Health Union, AMR is actually a common thread. So while it's not directly obvious from the onset, AMR is there, and many activities are actually kind of, addressing AMR. Next slide, please. So these are just to give you an outline of the main building blocks of the European Health Union. So we have the extended mandate of the ECDC, we have extended mandate of the European Medicines Agency, the ongoing pharmaceutical strategy, and also the legislation that's also being developed. The EU vaccines strategies, we have the new regulation on serious cross-border health threats that I'll go a bit more into detail. And we have the creation of a new commission service, which is HERA, which are actually also looking quite a lot at AMR. So next slide, please. So I just want to maybe bring to your attention where we are with these various milestones. It's a lot to keep track because there is a lot ongoing all at once. But actually this week, so the co-legislator, the Parliament and the Council reached an agreement on the new serious cross-border health threats legislation. So this is the main framework for health security in the EU, where AMR is also featuring. As the name implies, it might not be directly prominent, but AMR is listed and featured in this legislation. So now this week on the 24th of October, the Council adopted the legislation and the publication is now imminent. And then the same goes for the ECDC mandate that was also adopted and the publication is imminent. And then, okay, EMA and HERA work already ongoing there. Next slide, please. Maybe just to outline some of the areas that will be strengthened on the serious cross-border health threats legislation. So just bear in mind, this is mainly taking a human health perspective, but One Health elements are there, and they are also prominent in the legislation. Maybe the ones that are particularly relevant for antimicrobial resistance, the new elements, are really the reinforced surveillance. So the legislation foresees activities on European reference laboratories that ECDC will be managing in the future. So some of this work's already been ongoing in the background over the past years, but now the new legislation provides a kind of stronger framework and structure for the continued work of the European reference laboratories. And there will be dedicated ones on AMR. And then also there are new reporting provisions. So I guess the angle is a little bit more from the pandemic preparedness. But as the legislation also applies to AMR, this is something we're currently kind of looking at what could be done on the AMR side in terms of reporting on national action plans, and maybe also to have some synergies with WHO reporting that's already ongoing under their so-called track system. So we try and kind of avoid some duplication and see if we could use some of the WHO data for European purposes. So this is kind of ongoing in the background. Next slide, please. Yes, and then one major item that's also still ongoing that our colleagues are working on is the pharmaceutical strategy for Europe. So the main feature here is really the revision of the pharmaceutical legislation, and the Commission is exploring options for new antimicrobials and bringing these to market. And also this goes, of course, hand in hand. You know, we can't just bring new antibiotics to market, but this needs to also go hand in hand with prudent use to prevent their future misuse. So the prudent use aspects are also under consideration in this strategy. Next slide, please. So here, this is an important slide because, well, as a result of the COVID-19 pandemic, a lot of investment's gone into EU for Health. So this is the main funding tool that we have at European level. And well, due to the main competences, EU level, health is featured quite marginally. But now this is all kind of changing. So there are 5.3 billion euros available under EU for Health. And this is providing many new opportunities to address AMR with really significantly new funding. Next slide, please. So here I share an overview of the ongoing and upcoming AMR basically funded activities. I won't go through the detail of them all because I know we're under some time pressure, but just to show you, the various elements, and maybe one of the major ones that we're currently working on now is an upcoming joint action on AMR. So joint actions are member state driven, so the Commission is more steering or facilitating the process, but the leadership is really with the member states. So here, the submission deadline is in January, and the member state competent authorities are now kind of preparing their proposal for a joint action on AMR. Next slide, please. I'll just dive into a little bit more detail because this is really going to be one of the next big things, and the available budget is 50 million euros. That's significantly more than we ever had in the past. Just to put it in perspective, the previous joint action, it was really much, much smaller, and now there are many more opportunities with this enhanced budget. So this upcoming joint action would build on the previous joint action on AMR, which was already quite a great success. I know some of you here have also been involved in this work. So really taking it one step further, and the kind of main areas that will be addressed under the joint action are listed here. And this is work on progress, and France has volunteered to be the coordinator for this joint action, and then different member states will be leading different work packages and taking this work forward. Next slide, please. Okay, so Celine kind of touched on the international aspects of AMR. So these are all, well, some directly and some more indirectly linked to AMR. So the EU is now in the process of drawing up this, well, the Commission is in the process of drawing up a global health strategy. So this will take the shape of a communication, and it's still anticipated in this quarter this year. And while it addresses a whole range of aspects, and COVID is very prominent, AMR will also be addressed in there. So I encourage you to keep your eyes open for this. Then another, well, major item, I would say, international level is the pandemic agreement. And again, while the focus is more on the recent events, you know, AMR is also a relevant feature here. And the mission letter from our commissioner also highlights that AMR should be addressed as part of this agreement. So this is work ongoing, and I think for the next several months or even years to come. Linked to this is the Financial Intermediary Fund. So this is something, well, kind of a new structure under the World Bank. There will be a governing board with, several countries involved that will make the funding decisions on where, this big pot of money will be spent in terms of the also linked to the pandemic agreement. This is work ongoing, and the European Union is contributing there. Another major stream is the international health regulation strengthening. So again, it goes wider than AMR, but AMR is also going to have some benefits from this work, which is currently under review and ongoing, with several countries kind of tabling proposals for amendments that will then probably be taken forward at the 77th World Health Assembly. One item where the EU is a member and featuring is in the G7 and G20 negotiations. So in the recent years, AMR is always featured there in the health tract. And increasingly technical, I have to say. So the G7 presidency was with Germany this year. The health ministers already delivered on their declaration, where AMR is one of 3 main topics. So it really shows you that AMR is a politically really relevant topic and continues to be so for the G7 countries. And then the G20 negotiations are ongoing. The kind of geopolitical discussions also with Ukraine are kind of even featuring in the health tracts. So let's see how this work develops further. But AMR is definitely one area that all countries are interested in, and I think will feature in the end. And then I also lastly want to bring your attention to the Transatlantic Task Force on AMR. So this started as a EU-US cooperation, a kind of bilateral cooperation on AMR. It's since grown to include Canada, Norway, and most recently the UK. So this is really work at technical level and exchanges of information and best practices. There are certain work threads where work is being further developed. And it's been ongoing for several years and quite successfully, also surviving through, the Trump administration, for example. And the strength of it's really been the technical aspect, and that it's not necessarily a political forum. So this is ongoing with also ECDC strongly involved, or European Medicines Agency. Now we're trying to get HERA on board. And we adopted a new work plan for the years to come. Next slide, please. So I hope I've just been able to outline some of the main developments with more the human health perspective. I mentioned earlier, we have so many different stakeholders here. I think the EU contribution is really one part of the puzzle, and obviously we're very reliant on everyone doing their part, and we're looking forward to working with all the relevant stakeholders, and really we need to tackle AMR with this multifaceted approach, and you all have a very key part to play on this, and I really thank the organizers for bringing us all together. You have really great participants here from many different sectors, so I hope we can all work together on this multifaceted issue. Thank you.
Thank you, Julia, and thank you, Celine, for this very comprehensive introduction on the different policies that the European Union is implementing. I'm very pleased of this intense action, and also your last slide is summarizing very well all the international attention to that. Unfortunately, we are very late, so we don't have time for questions. And I would like to give the floor now to Dr. Malin Grape, which is Ambassador on Antimicrobial Resistance for the Ministry of Health and Social Affairs in Sweden. Dr. Grape is also, before that, was Deputy Head of Department for Communicable Disease Control and Health Protection in the Public Health Agency in Sweden. And she has a PhD in Medical Science from Karolinska University. And she has been doing a lot also at the national level, being National Sector-Wide Coordinator for the Antibiotic Resistance and also Director of WHO Collaborating Center for Antimicrobial Resistance Containment. So Dr. Malin, please, the floor is yours.
So much, and thank you for inviting me today. I'm really excited to listen to the rest of the program, so mindful of the time and that we are really lagging behind. I will try to shorten it a little bit and just share both a little bit, of course, for the upcoming Swedish presidency, but also a few of the experiences from the Swedish work that I think could be relevant here. I did have some slides. I'm not sure if they are available. Let me start meanwhile. As you heard, I'm Ambassador on Antimicrobial Resistance, appointed in March this year. The first, and unfortunately the only one. I do have a very good colleague in UK, the Special Envoy on AMR. But I would be so happy if more member states also appoint their own ambassadors. So I have some colleagues to work with. And of course, this role is really appointed just acknowledging how the huge need for tackling AMR jointly. So I'm working a lot, of course, now within the EU, but also my remit is on the international level. As you heard, based in the Ministry of Health, and my background is in public health, but of course I do represent the entire Swedish One Health approach to AMR, from which we have a very long experience. So next slide, please. As you have already heard, these are so exciting times to take on the presidency in the EU Council for Sweden. We have had AMR on the agenda for a very long time. Already in our our previous presidency in 2009, we brought up incentives for development of new antibiotics. Of course, we hope to really be able to contribute to a stronger EU action on AMR, and we have very, very good opportunities for this, I believe. Now, I must say, we have a new government in place since last week. So although we have been making plans for the EU presidency for a very long time, of course, you have to start planning. But we do need, of course, the input from the new political leadership, confirmation of all the plans we made. But I could still say that it's quite likely that we will have a high-level ministerial meeting on AMR in Stockholm in March. Very much looking forward to contributing to bringing the work forward. But as you have already heard a lot about, there is so much going on now. We have the policy initiative, the council recommendations that we hope being able to finish negotiations on, possibility for at least starting negotiations on the pharmaceutical legislation, probably not finalizing though. And we have for example, the strategy for global health, which is being revised, and we will draft council conclusions and lead negotiations on that. So I think, and in addition, as you heard, we have the EU for Health, the European Health Union, we have the establishment of HERA, we have the strengthening of the ECDC and EMA mandates and so on. So there's really, I think these are exciting times, and I look forward to being part of this. So next slide, please. Yes, I already said this. We have a long-term commitment. We have a long experience in working multi-sectorially. Our first national action plan on AMR was actually published already in the year 2000. And already then it was a cross-sectoral plan. We have made a lot of progress. We still have a lot left to do, I must say. So next slide, please. I wanted to share with you a little bit on some of the experience which I think could be relevant for this forum. Yes. So I made a selection. So I would talk a little bit about the National Stewardship Program that was established already in 1995. And it builds very much on the multi-professional teams, and not only infectious disease specialists, but general practitioners, and not only doctors, but also, for example, nurses, pharmacists, very often dentists, and even veterinarians are part of this work. And I think this is quite important to have this broad approach to how we are all responsible for managing prudent use of antibiotics, and which could be we use data, we compare prescribing patterns, discuss adherence to treatment recommendation, for example. But what I think it would be most interesting here is that we also try to support in the patient prescriber dialogue, which I think is key here. It's not, I mean, in Sweden, it's very difficult to get an antibiotic without a prescription. So prescribing is really key in addressing. But it's not only, you know, to decline or to stop prescribing, but you have to also have an understanding from the patients. And we try to support the prescribers in this, for example, with these information sheets or leaflets on the common infectious diagnosis, and these are translated into many different languages, and has a short description on what kind of infection the patient has, why they didn't get antibiotics, what signs they should be alert to if they would need to seek care again, for example. And I think this is quite useful also because patients expect something. They seek care, they want some kind of confirmation, right? So instead of going from the doctor with a prescription in your hand, you go there with this information leaflet in your hand. I think this has been a very good experience in the Swedish context, of course. Next slide, please. Another area which I think is extremely important, we can see from our data, we have the surveillance data, which we also report, of course, at the EU level. We can see we had a decline in prescribing of antibiotics, an uninterrupted decline for over 20 years. And still we had an increase in resistance. So it's obvious that it's not enough to prescribe less antibiotics. We will also need to prevent the spread, both of resistant bacteria, but also, of course, infections that would need antibiotic treatments. So I just wanted to highlight here that I think the infection prevention and control work is going to be much more important in the future. We also have, of course, the experiences from the COVID pandemic. So we have a regulation which came into place in Sweden in 2005. It was updated in 2017. And even maybe most important here, that it applies. I mean, we have a dress code. You have to have short sleeves when treating patients, hand hygiene, all this, and it applies to all healthcare staff. So that includes medical doctors. It's not very conscious to see doctors in short sleeves, but in Sweden, that is all over. Thank you. Next slide, please. What I think could also be of relevance here, but we need to come back to this, of course, is that we are working a lot also with awareness and communication. I mean, normally we do address mostly, when it comes to the health sector, the healthcare staff. But around these coming weeks, we also do, unfortunately, we're not able to do it all year round so much, but around the World Antibiotic Awareness Week and the World Antibiotic or the European Awareness Day. We do have also communication campaigns directed to the public, and that is the general public also in their roles as patients, as pet owners, or as consumers, for example. So there are many examples of this, but I think this is also an area where there is so much more need also. This is where patient organizations could contribute so much and really, I mean, make an important impact and advocating for strong response. Even though it concerns all of us, I think patient organizations also have the strength to really demand or expect more from the policymakers, from the implementation, from the healthcare, for example. So I will stop there and looking very much forward to hearing more from these aspects of the work. Thank you.
Thank you very much, Dr. Malin Grape, for highlighting this experience and these very important messages when it comes to infection prevention as well. And now I'm delighted to give the floor to our members. First, we will start with Jonathan Pearce, CEO of Antibiotic Research UK. As I said it before, the patient voice is absolutely critical and needs to be further highlighted when it comes to AMR and NHAIs. So we will try to build up a consistent patient voice to advocate for national policies to combat AMR and prevent infections, and I'm really delighted and I'm really keen to hear from Jonathan about his associations, but also what activities he's carrying out in the UK. Thank you, Jonathan. The floor is yours.
Thank you. I hope you can hear me, and thank you for inviting me. If we can, I know we're short of time, so I'll move through some of the early slides quickly, but we move on. So just very quickly, along with you know, being a research-based organisation, funding research and carrying out research, we carry out, we have a patient support programme and a raising awareness programme. We move on to the next slide. Thank you. And that's just a brief highlight of the services, the support that our patient support service provides. And what we try to do is link everything that we learn from working with and supporting patients affected by antimicrobial resistance. We try and build that into what our research is doing as well. So there's a sort of a link and a feedback between the two sides of the organisation. If we move on. Yeah, so for many patients, antibiotic resistant infections are a chronic condition and a potential death sentence. I mean, you know this from what we've been talking about already, but they're invisible and they have to live with them. For many of the people we're dealing with, they've run out of antibiotic options. They can't tolerate what antibiotics are available, and they're at a point where they're desperately seeking solutions or, you know, alternative options, which are not necessarily in mainstream practice or medicine at this point, and certainly not always available in all countries. So common examples in the UK are people are looking at the possibility of phage therapy, for instance. If we move on. Yeah, and so what we, you know, are the services we provide through the staff working on this side of things are listening to what patients are telling us. And what we hear time and time again is this, the story of over-reliance on limited or poor microbiological testing methods. And it just means that the patients feel they're not believed, they're not trusted in what they're telling them. And that can extend to both the healthcare professionals they're dealing with, the doctors and so on, but also their families and friends. And that means that they lose confidence in who they are, their experiences, the story they're telling. And in practical terms, this means that treatment is often denied because they're not believed. And the repeated treatment failure using antibiotics that won't work for them drives them to research and find their own treatment therapies and so on, as I've just mentioned. Next slide, please. Yeah, and for the patients we work with, they see their resistant infections as an issue of inequality. It's an illness of inequality. So lack of acceptance or affirmation by the patient's ongoing suffering by the family. They need to travel hundreds of miles or to go to specialist centres or find different treatments and so on. And there's a lot of people that a disproportionately high number of women in particular that we work with that are silently suffering from very difficult, very challenging recurring UTI infections, urinary tract infections. Next slide, please. Yeah, and so if you listen to what our patients are telling us, you see that there's a massive financial burden on the individuals as they try and cope with their resistant infections. There's pressure on health services and social services to deal with their conditions and the services and support they need. And then it has a huge impact on carers and families when the patient can't look after themselves or their home or their family lives or their children. They can't contribute financially and they can't engage in the things that you and I take for granted. Celebrations, holidays, etc. We move on. I think, yeah, and when you listen to the patients, when they tell their stories and the experiences we have of trying to help them, you often hear how they talk of their lives shrinking. Their quality of life is reduced. They've got less to live for. That and sometimes their symptoms so affect their lives that there's less that they can do with their lives. And for many patients, they say it's not their life isn't worth living, and many admit to suicidal thoughts. Next slide, please. And so in the final slide here, we've just got some examples of the patients, the people that we've dealt with, who are all happy to tell their stories and see their own stories and communicate them as part of a wider patient advocacy movement. So Rhonda here, she had a catheter-acquired multi-drug resistant urinary tract infection after surgery. It wasn't identified and eradicated at the time. It developed into sepsis. She has an infection that flares up regularly and affects every aspect of her life, like we've just been saying. And she has this constant worry that she's going to get another bout of sepsis and that will kill her. And so you can see in her own words, this is a global cry of help for governments to finally take responsibility and take urgent action by ploughing money and resources into developing new antibiotic treatments to save lives and to avoid a lifetime of worry and pain that is constantly that one is constantly subjected to whilst living with an antibiotic resistant infection. And so if we move on to the next slide, another story here. So, and if we just do one more click and I'll put up the quote as well, please. So Rachel's story, she had recurring resistant UTIs by the age of 16, which was putting her into emergency care. IV treatment for sepsis was followed by prophylactic treatment. The infection she got from that, ESBL E. coli, meant isolation for her. There was little information support or aftercare, and ultimately she needed better testing and more effective treatment. And in her words, I believed I'd always used antibiotics correctly, so wouldn't have been at risk of antibiotic resistance. How could this have happened to me? The more information I gathered during my own research into this, the angrier I became, realizing there was nothing I could do. I realized to my horror that infection caused by bacteria resistance antibiotics can happen to anybody, even me. And then if we go on to the third story we have, third experience, Nina's story. She had a gallbladder removed. This led to an ongoing septicemia infection. She had a rotating regime of 3 antibiotics. And though she's been told she only had 5 antibiotics left to treat this infection. And each round of antibiotics takes longer to work than the last time. So she needs better testing and wants more research on existing combinations of treatments and new antibiotics. I would really like to know what the future holds, but no one seems to know or understand if I would always have these infections or what might happen. I feel I've had this wake-up call that life is too short not to make the most of each day now. I didn't know about antibiotic resistance before my illness, but now I want to play my part in making a difference. And these and other patients help us communicate the messages and raise the awareness that we want to try and sort of bring about an end to antibiotic resistance. And if we just move on, I think those are essentially my slides, just an indication there of what supports and encourages patients most, knowing that action is being taken and that some of the things we're talking about are in training in progress. And then finally, on the last slide, I think it's, people realizing they're not alone. And then the last slide just got our contact details. So thank you very much. I hope you can see sort of the importance of the patient perspective in the work that we're all doing. and how desperate the need is amongst those patients. Thank you.
Thank you, Jonathan, for having highlighted this your excellent work, and also some of the patient stories as well. And now it's time to hear from Vanessa Carter, who became an AMR patient advocate in 2013 after surviving a serious car accident and a 10-year facial reconstructions that caused a highly resistant MRSA infection for 3 years of overall recovery. Vanessa, the floor is yours. Thanks for being with us today, for sharing your personal experience.
Thank you very much for having me. I'm going to be talking from a practical level, from a perspective, a patient perspective. If we can go to the first slide, please. So storytelling, and I think this session that we're talking about right now is important because it's the power of personal stories. And so because I only have a few minutes, we're short of time, I'm going to run through my slides very quickly. But this was my last photo at age 25 years old. Next slide, please. Before I had a car accident, this was where I was resuscitated on the side of the road. I was taken to Charlotte Maxeke Academic Hospital, which works with the Wits University in Johannesburg, and fought for my life in that hospital until eventually, next slide please, going through a almost 10-year facial reconstruction. And so as you can see, there were a lot of times that I thought I was going to die, a lot of times I thought I was going to lose my face. The one particularly on the bottom right hand side is a hairdresser who at that point in time when I had the car accident said to me, I had so much car pieces in my hair and blood and so on that she said, you know, you're not going to shave your hair off. And that's what I felt like I wanted to do because I was in so much pain. So we became friends after that, but she became very memorable in my journey. So yeah, next slide, please. So I had a lot of injuries, and in my 6th year, most of the injuries that were caused was to my face. And the face is a very complicated area, so I had to go see different types of super specialists. And this basically happened in Johannesburg. And each one, when I got to a point where it was a particular prosthetic that was implanted, each one gave me different opinions. So for example, if it was a plastic microsurgeon or a plastic craniofacial surgeon or a maxillofacial craniofacial surgeon and so on, the opinions that I was getting was to either do a micro, soft tissue reconstruction, and then at the same time they would say to me, take this antibiotic for the next 14 days while you're waiting to go see the next surgeon. So in other words, the maxillofacial surgeon saying, take a 14-day course of Augmentin and then go see your ophthalmologist or go see your ENT surgeon and see what he has to say. And then, of course, I'd go for the surgery. And during that surgery, they would do prophylaxis. They would prescribe antibiotics that were kind of trying to prevent infection. In the meantime, I had infection. And so eventually, this is kind of what my face looked like. And you can see on the left-hand side, lots of pus coming out, lots of, I was freaking out going, what the heck is going on? Next slide, please. So this is what I call on the left-hand side, my point of no return. My photo in my life that was called the point of no return, where I looked in the mirror and I said, wow, first of all, I cannot wear a prosthetic eye because it cannot be held in place because of all the tissue damage from this infection. And on the right-hand side is a list of all the antibiotics that I was resistant to or susceptible to. So the R's and the S's going down the list. And at that point in time, I didn't understand it, but what happened was I went on the internet and I started to ask questions. Next slide, please. So by doing that, by taking my medical records and asking for help, because now I got to a point where I said, you know what, I'm going to lose my face. Let me start asking, surgeons overseas that are doing like extraordinary work in facial reconstructions, because I know that by now I cannot afford any more failed surgeries. So I ended up connecting with a face transplant surgeon, a craniofacial surgeon in Boston Brigham's and Women's Hospital, who's associated to Harvard University. And strangely enough, I mean, I was so lucky that his secretary said, Dr. Kedison is willing to offer you a 30-minute Skype call. He sees cases like yours all the time. You need minimal surgery. All you need to do is what they call a zygomatic osteotomy, meaning they needed to cut the bone, use as few foreign objects as possible. And so we did have the call. We had Skype call, and then I went through Johannesburg to find doctors that mimicked that. Next slide, please. So even though we did the zygomatic osteotomy, we tried to, do it in minimal surgeries. I did get an infection back, and I keep saying to myself, when people say you got the infection back, it was like, well, can you imagine if I did multiple surgeries that were unnecessary? I did this in one surgery. And so when we did diagnostics, it ended up being potentially an infection and also an allergy to the antibiotic that I was using, and potentially was a topical antibiotic. So Bactroban and Chloromex was what I was using on the surgical site. And slowly but surely, 2 months later, I started to look okay. Next slide, please. Next slide, please. And so I started off my presentation saying that was my last photo. Well, this was my first photo 10 years later, 34 years old. I could look at a camera and I felt comfortable. Thank goodness to the doctors and to getting over that infection, which, for 3 years nearly destroyed my life. So next slide, please. So when we start talking about patient involvement and patient perspectives and patient advocacy, in my mind, there is this, you normally see the iceberg effect. What you see on the top is different to what you see on the bottom. So I started advocating back in 2013, 9 years ago. It was literally after I finished my craniofacial reconstruction. So I've been working in AMR for quite a long time. And I've done all sorts of things. It was not just about storytelling on stage. It was not just about being here today, sharing my story. It was about also working in policy. So the second portion of the slide that you see here now was me working with the World Health Organization as a patient advocate, as a patient voice, to share my views in terms of antimicrobial stewardship. Radio interviews, broadcasting, media. On the right-hand side of the slide, I've also worked with antimicrobial stewardship teams. So it was quite amazing because after all these years of being in advocacy, Charlotte McSake, Johannesburg Hospital approached me and they said, we've got an AMS team that we would like you to come and share your story with. And maybe in that sense, it could motivate those nurses and doctors and so on to take more care of their patients by hearing your personal story. So I've done that as well. I've worked in medical education. I've worked on e-courses. That's the picture slightly down. I've worked on a few actually, including dental antibiotics, because of course I'm a maxillofacial surgeon. Top right-hand side, I worked with Stanford University in co-creation workshops. And so this is really important in terms of, patient advocacy. How do we take it to the next level? We co-create solutions. We co-create branding. We co-create marketing, because I've sat in GP's offices in the UK where I live right now, even though I've shared a South African perspective, and I can't find the flyers sometimes. And the GP doesn't always talk to me about antibiotics and the risks of it. So co-creation is very important in that way. And of course, with pharmaceutical companies, including when they don't publicize the risks of antibiotic resistance on their pharmaceutical packaging. The next image down is me working in research. So I've worked in some cases in terms of co-creating surveys and working on research projects with medical researchers. I do not have a scientific background, but they helped me, they guided me to do that. And of course, Stanford also have a course, e-learning course, in terms of patients working with medical researchers. And then the final part that I'm going to put here is the AMR narrative. So this is a charity that I'm busy establishing at the moment. I've got 7 trustees, and hopefully from there, our objectives will be to promote and build other patients, advocates like myself, and with all the experiences I've gone through for the last 10 years. So thank you very much for having me. And that's my presentation. Thank you.
Thank you, Vanessa. Thank you so much. Despite your story, your experience, you stayed very strong and also felt a need to create change across Europe, but also beyond. So you are now actively engaged, and I'm really delighted to have you on board. And thank you for your active and meaningful contributions to the activities of Health First Europe and the AMR Patient Group. Now we only have 10 minutes left, so I kindly encourage both Christian and Miriam to stick to 5 minutes, please. Thank you for staying a little bit longer with us, also to the online audience. Christians, what are the recommendations, what are the solutions that you have representing European doctors when it comes to AMR?
Yes, thank you. Maybe you could immediately go to the next slide. So we're CPME, we're representing European doctors. Membership is our national medical associations. And if you go to the next slide, it's a very important topic for us, where we work too closely together with the ECDC and also working on the European Antibiotic Awareness Day. We published the results of what doctors know after a survey from the ECDC on antibiotics. And if you go to the next slide, then you see that what we know now, that we doctors have a basic knowledge about prudent use of antibiotics and the risk of resistance. Doctors are aware of their role in providing advice on the prudent antibiotic use, but we also have a lack of resources and insufficient time, and that are barriers for doing so in practice. What you also see, for example, recently we saw an advice of a Minister of Health who said to decrease the burden of general practitioners, antibiotics should be readily available. So that's not a good example for it. So we have to work hard on that. So the antibiotic stewardship is important, and the doctor's knowledge about it is very important. But the most reliable and popular source of information about prudent use of antibiotics for doctors are published guidelines. So we want to focus on that. If you go to the next slide, the guidelines on antibiotics are important for the professionals, but you can also use them for the patients to make them aware to use the proper antibiotics. We see a lot of patients in our practices who just want to ask for an antibiotic because they're not feeling very well. So you have to be very prudent about that, and that's a thing that doctors should do together with patients. And I thank Vanessa very much for her talk on the examples on that. So for us, we need to diagnose the patient in person. So only on an exceptional case you can prescribe a teleconsultation. We think it's very dangerous. You have to have a good clinical diagnostic examination before initiating therapy. And then you also need to more readily available diagnostics also in the primary care. You must know that the patient has a bacterial infection, otherwise you will just increase resistance. And of course, we need to choose a narrow spectrum antibiotics as specific as possible as first choice. What we see in a lot of European guidelines is that there are good recommendations on that, which test to be used to go as small, narrow antibiotics as you can be. So if you go to the next slide, our feedback to the council recommendations and AMR at that just focus on those precise national clinical guidelines for antibiotic treatment and encourage the competent authority to do so. And then member states should also strengthen the doctor's access to better and faster diagnostics and hereby develop a better guarantee of prompt and correct diagnosis. Prioritize educations and the audit of use of antibiotics, and all our members, national medical associations, should call on their governments to educate patients that antibiotics, when prescribed, must be taken long enough as prescribed and thus improved in compliance. And that we should follow the guidelines on this prudent use, which means only prescribing antibiotics when necessary, ensuring use in correct dose intervals and for the correct duration. So on this topic, we're doing a lot to our membership that are our doctors in Europe. We want to focus on these guidelines, but we're also very much working together, for example, with the veterinarians on the One Health approach. And then you see in these audit systems, for example, in the Netherlands, you also have a very good system in the veterinary use of antibiotics. And I think that will be implemented now in all of Europe. That also will help in tackling this huge problem on antimicrobial resistance. Thank you.
Thank you, Dr. Christian, for, I hope that you can hear me well. Yes. Thank you, Christian, for sharing these powerful messages and very critical solutions from the doctor's perspective, especially for highlighting the need to produce national clinical guidelines for antibiotic treatment, and also, calling for health authorities at EU and national level to strengthen doctors' access to better and faster diagnostics. And because we talk about medical technologies, diagnostics, I'm really delighted also to have an industry representative today in the room. We have Miriam D'Ambrosio, External Affairs Manager, Communications at MedTech Europe. Thank you for being with us, also for sharing the critical role the medical technology solutions play in the fight against AMR, but also to better detect and prevent infections.
Thank you so much, Laura. So I should have also a presentation if possible. Yeah, so we all agree that microbial resistance is a silent pandemic, and it's happening now, and it's anymore a future threat. So each of us has to play a role in this, and the medical technology industry is also a key player in this fight. So we are, next slide, please. We are focusing our attention on an important aspects of the fight against AMR, which is prevention. Prevention is an important aspect, as said, like it's, for instance, the need to develop new antibiotics. So the medical technology industry is very close to the patients and is following the patients alongside the full patient's pathway. So from the admission to the hospital, or even in the community, to the arrival at the ward, in the operating room, or during the hospital stay and recovery, and until the moment the patient is discharged and sent back home. Just to give you some, briefly, some short examples on how the medical technology can have an impact on this. So whenever a patient is admitted to the hospital, he is screened to check whether he is colonized by bacteria. And since we all know that antibiotics don't work on viruses, it's important to have this diagnostics information to help a healthcare professional to set an efficient healthcare plan. And then, for instance, in the context of a surgery, an infection can easily occur in that part of the body where the surgery is performed. So there are plenty of solutions to prevent the spreading of infection, and like, for instance, ensure a proper ventilation in the operating room, or having good practices in the sterilization, or also using patient's warming system after the surgery. So next slide, please. Before I go on, just shortly who we are. So MedTech is a trade association representing the medical technology industry, including medical devices, in vitro diagnostics, and digital health solutions. Next slide, please. We have more or less 500,000 products on the market. So you can easily understand the kind of magnitude of impact that our sector can have in the fight against AMR. So next slide, please. Just to give you some short examples on this context. So for medical devices, I can count antibacterial sutures and implants, or as I was telling you before, patients' warming devices. And for in vitro diagnostics, well, without diagnostics, it's almost impossible to see if there is an infection from bacteria or viruses, and how the patient is also responding to the treatment. So all this information are useful to avoid misuse of antibiotics. So next slide, please. We all need to change habits, and to win the fight against AMR, we need to follow strict guidelines and strict guidance. Also, in this context, the medical technology industry can support, it can help, because it's following all the phases that the healthcare professionals need to follow in order to prevent the spreading of infections. Next slide, please. If effectively used, the medical technology, well, all these solutions can prevent and contain the spreading of healthcare-associated infection, and also the spread of resistance in bacteria, so which will then could lead to the AMR. Then we can detect and identify the bacterial infection and the way they respond to the medication. The medical technology solutions also help to monitor and track resistance, and check out also the patients are responding to the appropriate use of antibiotics. And lastly, well, we all are familiar now after the COVID pandemic, how important it is also to manage the outbreak and to the surveillance phase. So thanks to the medical technology, we can track, control, contain, and prevent the spread of pathogens at all levels, so from local to the international level. So next slide, please. As said, AMR is a silent pandemic, and here it's too big to be tackled by only one stakeholder. So there is a huge need to work together and stop working in silos. So we need to open a frank and transparent collaboration at all levels, because I mean, here failure is not an option. Otherwise, we will face serious consequences. Thank you.
And I couldn't agree more. Thank you, Miriam. Indeed, AMR, it's a silent pandemic. It's a serious public health threat. And also it's quite complex, and certainly needs a lot of buy-in from different actors, like also COVID-19 has. I think COVID-19 has brought so many lessons on issues like vaccine awareness and people's often fearful reaction to that. So today we have heard many important messages and some of the solutions that are needed now, not later in the year, when it comes to fighting antimicrobial resistance. And I really hope that you enjoyed the presentation, the discussion, and also that the contacts you have been making here today will continue in the near future. Certainly, Health First Europe will be continuing to be very active in this field with as many patient advocates as possible. I see many members as well in the room today, and we will be supporting in 2 or 3 weeks also the ECDC annual campaign. I would like to truly thank you all. I'm sorry that we have been running a little bit late due to some serious technical issues at the beginning within the Parliament premises. Really apologies on behalf of Health First Europe. But once again, thank you all. Thank you to the speakers for their excellent and very clear, insightful presentations. Also to our president, Dr. Roberto Bertolini, for his valuable contribution and moderation at the beginning of the event, and also, of course, to my team for the great organization and the great speaker lineup, as well as to Justine, who belongs to the office of MEP Knotek, who has been of tremendous support. Thank you so much. As I said at the beginning, the recording will be available on our website, the European Patient Group on AMR website, but also the website of Health First Europe. And also we'll be collecting questions. There will be plenty of questions in the WebEx chat. So don't worry, we will be merging them, and also hopefully we will address them to the expert speakers. So feel free to contact us also separately. Thank you once again, and I wish you a lovely day ahead.